Continuing a conversation with this extraordinary guest about healthcare, let me quote Marcy from you. What better person to quote than the guest? Quote, "We must change the conversation about healthcare reform to center around patients and not insurance. Insurance is an actuarial bet that no one hopes will ever have to utilize. It should be readily affordable. Healthcare, on the other hand, should be something readily accessible to any person who seeks healthcare, be it preventive or creative." So the essence is, again, that relationship between the patient and the doctor.
Precisely. Insurance is an actuarial bet. You buy insurance to protect you from the, God forbid, catastrophe of financial ruin if you get sick. Insurance doesn't pay for a doctor's visit. It shouldn't pay for a doctor's visit.
That's right.
Of
That
course
should
not.
be for the catastrophic stuff.
Absolutely.
Everything else should be free market driven.
Precisely. We
Wow.
don't need an interview. Art gets it. And actually, everybody that I talk to gets it. And when I went to Congress, individual congresspersons and senators understood that they didn't know how to make it work legislatively because they were dealing with their own election or they had a lobbyist. They know what will work.
How do we get there from here?
Simple. First of all, we stop what's going on now. We got to stop this.
Stop this bill.
We have to stop it. We have to stop it. It's so complex. Oh my goodness, 2,100 pages, and I've read them, which only tells you I have too much time on my hands, but that's another story. So you stop this and we start incrementally. First of all, let's make insurance affordable and accessible, but we must make it insurance. So why does a 20-year-old young man not buy insurance? Because he can't afford it, and because the product isn't one he wants to buy. He doesn't need fertility care. He doesn't need bifocals. Why would he want to buy that benefit package? Benefits are a different opportunity than insurance. If I go to buy a mammogram for myself, and I do, it costs me between $75 and $100 cash to purchase my mammogram. That's all. If it goes through my insurance company, it costs over $200.
Wow.
Yes, it's less expensive if we can buy it in that free market. On the other hand, God forbid I should be in a traffic accident, have cancer, have a heart attack.
So that's the insurance you want.
Because it's unpredictable. You can't insure a predictable event. You know, when your
That's right, we are. We're getting insurance for, you know, you're going to get certain medical treatments each year.
Hello, exactly.
Now, for the record, Dr. Zwelling gave up a traditional practice and some years ago went to her current model, which we will put up at the end of the segment, choice care. Mm-hmm. And the patient comes in, pays you for your services, mm-hmm. and then seeks whatever reimbursement he or she might be entitled to, but it has nothing to do with
Precisely.
Your pricing and what care you decide
Precisely.
he or she needs.
When my patient says to me, "Doctor, I need to see you," all I have to do is say, "Come on in." You know, access to care is, "Hello, how can I help you?" It's not, "What kind of insurance do you have?" That's an insult.
That's the first question when you walk into many doctors'
How
office.
insulting.
Let me see your card, and if you don't have the card, adios.
And what difference should it make? Yeah. The answer is none. So you buy an affordable care package that has catastrophic care. Now all of a sudden your premium is reasonable. You go to your doctor, and all of a sudden the doctor is in a competitive marketplace. You know, I answer to my patients, Art. If I don't do the right thing, they get to go someplace else. They don't find me on a list. They don't come and see me because, you know, I came to see you, doctor, because I got insurance. What?
In the old days, and this is true of lawyers as well as doctors and others, it was word of mouth. It was a reference. Someone would say, "I got a good service from so-and-so, go see him or her."
Precisely. That's how most of my patients come to see me. Some find me on the web or they're looking for my kind of practice, but as it should be, because it's relationship driven.
Relationships, not transactions.
Precisely. It's not event driven. I don't care how many times my patients need to see me, as long as I make them better. If my patients come once a year, then maybe it's because I've done a good job. But if the insurance company, if I'm wedded to the insurance company, then what happens is that everything is a financial transaction.
Must have been a moment of truth for you when you left the system. the security of the system.
Oh, yeah.
And it ventured out into this relatively rare, I would think, model.
Yes. At the time, I was the first in the area to do it. I'm now president of the National Association with the American Academy of Private Physicians.
That do it this way.
That do it this way.
Is that? I bet that's growing.
Like leaps and bounds. I mean, we have a regional conference in Phoenix that is almost booked before we've even sent out the brochure.
Wow.
Yeah. I mean, because...
And almost all of your doctors, I suppose, are opposed to this health care plan.
Yes. You know, but most doctors are opposed to this plan.
Really?
Oh, yes.
How come they don't weigh in? Or maybe they are.
They are.
Or are they afraid to?
No, they are. It's just that, indeed, I have the privilege of being here, but that privilege doesn't come to every physician. And, you know, the newspapers haven't come to ask us, unfortunately. They've asked the AMA.
Most doctors are opposed to the health care?
Absolutely opposed. Absolutely
Wow.
opposed. Most doctors want to go to work, take care of their patients, make them better. Why did I go to school? Why do I get up in the morning?
We'll find out after these messages.